No, no.
First hold it.
So this is the moment. Certificate of Award by Bombay Psychiatric Society. This is to certify that Dr. S.M. Lulla Oration Award 2026 has been presented to Dr. Joyita Devdar on the annual day function of Bombay Psychiatric Society held on 12th April 2026 at the Geo Convention Center, Mumbai. And her topic of oration that we are all waiting for is When Psychiatry Met Oncology.
Now, may I please request ma'am to deliver her oration?
Good afternoon, everyone. And although I haven't met Dr. S.M. Lulla in my training in psychiatry, but having worked in psychiatry, having worked in Bombay Psychiatric Society, year after year, we have listened to about Dr. Lulla. And I think every time it is a different aspect of it. So the breakfast bit, I don't think I remember from previous discussions about Dr. Lulla. And I think it is indeed an incredible honor and privilege, huge privilege and honor to be the recipient of Dr. S.M. Lulla Oration. And of course, thank you to BPS, Dr. Shobha Nair, Dr. Prashant Shah, and the entire team. And thank you, chairpersons, Dr. Dhawle Madam, and Dr. Ashish Deshpande, who you heard how long he has known me and still remains my friend. I wonder why. So I want to, for those of you who know me a bit, will know that I am a big movie buff. And that is what inspired this title. So it is When Psychiatry Met Oncology, and I think I styled it in the form of When Harry Met Sally. So I want this to be, I'm going to talk on not as psycho-oncology as such, but I want to tell you about the one founder of the discipline and the movement that she started is with one person, one woman, one psychiatrist who is Dr. Jimmy C. Holland. So a bit about Dr. Holland, Jimmy Holland. I am saying Jimmy Holland, you will know later. She was born on 9th of April 1928 in one of the rural parts of southern Texas in US. And she was born during the Great Depression. She was one out of 6 or 7 children, much like Dr. Armida. And her father was a cotton farmer. The mother was at home raising children. And though she was born during the Great Depression of America, which we keep hearing about, her mother raised her to be with a drive for optimism and doing things for people. So she was in 1940s, she joined the Baylor College of Medicine. In that batch, she was one of 3 women of 80 students who joined medicine. And because she was born in that rural part, her dream was always to go back to, and practice as a rural community general practitioner. But somewhere when she was doing her medicine, she thought that she listened to people's stories, people's coping with different illnesses. And that was when she thought that she didn't want to take up surgery, but because she wanted to listen to people and always wondered about how people were coping, she took up psychiatry. And she did this psychiatry in different places, which was she did her St. Louis City Hospital, and then later on she did her psychiatry residence in Massachusetts General Hospital. So that she finished around in the 50s, and in 1956, that is when Sally met the Harry, and she met Dr. James F. Holland. So I don't know what serendipity that was. Jimmy Holland met James F. Holland, who was a brilliant young oncologist. And he was one of those innovators, think out of the box. And he was the chief of Roswell Park Comprehensive Cancer Institute at that time. And it was 1950s, and there was a lot of mortality. And he, along with his friend, Dr. Lloyd, from murine models, got the first sort of chemotherapy protocol for using combination chemotherapies for children with acute lymphoblastic leukemia. And this was called as Protocol 1. That was the first ever sort of chemotherapy protocol in this. So he was a brilliant young man. So she was, when they went back to Buffalo, etc. She had 6 children. That seems to be the norm. 6 children. She worked part-time during that time to raise her children, and part-time she worked. And then she must have pestered Dr. James Holland, or Dr. James Holland understood it. So when they were doing the protocol, it was about what protocol, what dose, what adverse effects, what will the patient do, what monitoring to be done. And she said during that time, she thought that no one is really asking about how does the patient feel about this, the chemotherapy protocol, because everybody was busy trying to measure the physical aspects. But what about the mind then? So what about the person's feelings? Because it's a person in which the disease is there. So you're doing part of the disease, and therein came that whole thing. And this was already a previous thought, that what interested her was how people coped with their illness. And when it came to oncology, then it was about what were the patients feeling. So then they worked on it, and then they she sort of, they made the movement to have the first sort of psychiatry service in an oncology center, which is the Memorial Sloan Kettering Cancer Center. And that was the chief of psychiatry. They set up the department in that time in about 1977. And that was the first time ever anywhere in the world. And so that they were quite a power couple. So she did a lot and he did a lot for the oncology practice. And they moved on to doing different things, and the whole, the research, for any sort of research, you have the oncology cooperative group or cooperative oncology group. So you will always see pediatric childhood cancer cooperative oncology group, etc. So he was the first one to start it. And then with the chief of psychiatry, that she became, so she is the first ever. And till the time she died, it was Christmas Eve 2017, she continued to work on that, and she was the Wayne E. Chapman Professor. So you have to think about, okay, that why a person feels what he feels when he has a disease, a dreadful disease at that time. And it seems in that time, in 1950s and 60s, that people didn't really speak the word cancer. No, we think that we do it here, didn't want to. It was the big C. So people didn't talk about it at all. So from then on, to sort of go on to make it as discussion, make it as a topic, and that you have to be, that you have different coping skills, different emotions, but you need to make it a science to be able to prove the discipline and hence to get the evidence. So it is good to be caring, but you need to make it the science of caring. So it's, it was like people, like I said, how people with otherwise good mental health, how did they respond emotionally and psychologically life-threatening illnesses. So she did a lot about the science. So as to what emotions, how to measure, and she worked with the National Cancer Institute to make this as the sixth vital sign. So pain, temperature, blood pressure, respiratory rate, pain is the fifth vital sign, and this is the sixth vital sign. And she worked a lot on making this into a research priority, because ultimately you may think something, but the proof is in the pudding. So she worked a lot, and with her, as I said, the power couple husband, and she received the highest honor of the American Cancer Society, which is the Medal of Honor, and of course multiple honors that she received. And to this we owe this discipline. And so we'll come back to her, because what starts with her will end with her. We'll come back to her. And I just want to talk briefly about how did I get into this, which is not a very romanticized story. It is just very serendipitously. So of course I belong to this, my post-graduation in psychiatry and KEM hospital. And after finishing my residency, I happened to I did my MRCs, my basic specialist training and higher specialist training in general adult psychiatry, which is in Northern Ireland, who despite being in the island of Ireland is a part of the UK. So I need to say that. So that is why the map. And when I went to Northern Ireland, it's a whole province, but my main I was based in Belfast. I lived in Belfast. I spent 7 years in Belfast, and I think that is one of the best times that I've had in my life. One of the best times I've had in my life. So you had to go in the whole province wherever you did. So you changed every 6 months to a different specialty till you did your MRC psych. And then once you did that, you got into higher specialist training, which I chose in general adult psychiatry. I know child psychiatry is quite the rage, but I stuck to general adult psychiatry. So, so I did that, and I have said here, what more did I learn? And that is because we are from KEM, so we know everything. And despite not being allowed to, we were not told to do anything and experiment. We were not allowed to experiment at all unless under supervision. So, so despite that, what more did I learn? So there were some things that really put things into place, and why I'm talking that here is because it affected my sort of practice later. So I really like the formulation that they have. So the question was, why did this person get these symptoms at this time? Why now? And for that, you needed to have a grid, so predisposing, precipitating, perpetuating. And each of that grid would have biological, psychological, social, environmental. And that was, you had to learn it because that was one of the things that was very much stressed in the exam. And the exam was, the examiners had to be prepared as well and trained as well and not ask whatever you read in the previous day. So the examiners were, and there was an observer to observe that the exams went on. So this was very good. What more did I learn? I did a year in psychiatric intensive care unit. So it was a low secure unit. So all the extremely aggression, severe mentally ill patient, and it's like an intensive care unit, but it is psychiatry intensive care unit. I think you've heard that in one of the webinars that Dr. Santosh has done. And I got into a lot of committees. So the RC Psych had a psychiatry training committee, and I got into that, and I got into the CPD committee, and maybe that's what influenced me to get into the Bombay Psychiatric Society. So 7 years later, I came back to same Parel. I can't, I'll have probably withdrawal if I leave Parel at any time. But so 7 years back, I came back to Parel to work in this in oncology, which, like Ashish, I was also sort of wondering what is, because all you hear is about the depression, mortality, morbidity, how will you work, etc. So I actually did a year on just as not as a regular employment, I did it to see how I liked it. And it was Tata Hospital has very strict interviews, so I think there were like 9 people who appeared in the interview, and I got that. That's where. So through the years, it's one disease, but it's biologically how you say schizophrenia is a spectrum, anxiety spectrum, depression spectrum. So oncology, even if it is a head neck cancer, even if it is breast cancer, even if it is a colorectal cancer, the biology can be quite different. So one disease, and I learned many lessons from many patients, but 2 patients in particular. So there was this 60-year-old gentleman, head and neck cancer, post-op, and he was referred for anxiety. So whilst doing the evaluation, and it was about anxiety, you ruled out no sort of previous history, no medical causes, not pulmonary thromboembolism or whatever that was happening. So he said that, he had head and neck cancer post-op, so of course he had a he had a flap, so there was a change, body image. And he said that, Dr. Sam, whenever I saw people like this with cancer, with whatever deformity, I always thought that कुछ तो पाप किया होगा. So इसके लिए ऐसा हुआ है इधर. तो अभी मैं ऐसा हूँ, तो बाकी लोगों को भी लगेगा कि this is, I must have done something. And that was the sole cause for the anxiety, as to what the other person, or how, not other person, how society was seeing him, right? And then there was this 17-year-old girl with an osteosarcoma. This is very early in my career in Tata, and that is why it left an impression, and it's 20 years and I still remember them. Osteosarcoma, post-amputation, and prosthesis and everything, and she was referred for low mood. So 17-year-old girl from Chhattisgarh, father railway employee, parents used to come with her, very intellectually aware, and proper depressive symptoms, depressive disorder, went through whatever treatments, psychosocial interventions, antidepressants, prosthesis better, kept coming for follow-up, was supposed to appear for 12 standard, couldn't do it because had just undergone the surgery, so had to wait for a year for 12 standard. And then she got, and that time it wasn't, it was the marks, the state marks, and that is how you would get into medicine. So then she got into, got into medicine, but she got into the disability quota. And she had a prosthesis, so she had a disability. She got in disability quota, and she said, no, that I'm not going to get into the disability. I am what I am. And she did not take it that year. She got into a regular seat the next year. And she did medicine. She did surgery. She did gynae oncology, and came to appear for an interview in Tata Memorial Hospital 2 years ago. And now she's married, she's got a kid. So this is the individual, right? So you have the society and you have the individual. And that is where we have the strength. And we always look at it, oh, how will it happen? But you have to look at it at the other side and see the resilience, because these are the stories that we are going to tell people. And there's obviously we have been in touch, and this is, so it is many, like how Dr. Holland had said, how each person reacts is going to be different. And it taught me a lot, and it taught us a lot, because we cannot have our, what did Madam say, not have our own thinking and prejudices that it is a big disease and big things and what will happen. We have to work with them, and whenever we have to support, we support. And it's whole thing, it's cancer, it's depression, it's everything, it's done. Sometimes stories end well, many times stories don't end well, but whatever the journey is, I think we in the mental health profession are going to be able to help. So this is how now, whenever I've joined, we have come to the 85th year of Tata Memorial Hospital. We just had our hospital day on the 28th of February, and I'm still there. What has happened globally? Globally, from the time that Dr. Holland started, 1977 was her the starting of the psychiatry. Then 1984, she formed the International Psycho-Oncology Society. 1986, she formed the American Psychosocial Oncology Society. And that is what you see, that high income, middle income, low income, psycho-oncology is getting there. And you can see there that this is what is an IPOS federation, that when we have our own society for psycho-oncology, we can be part of the federation. And you see in the second column, second row is our name, India, because we became a society last year. What then is it in India? So, clinical services are still in tertiary and regional cancer centers. We have clinical counseling psychology professionals. Only 2 centers have full-time psychiatrists. So if no in-house clinical service, we will have to refer to general multi-specialty hospital for psychiatry, psychology, or if it's private sector, then hospitals running oncology programs, they may be giving that own service. And a lot of non-governmental organizations do voluntary work in collaboration with hospitals and in community. And a lot of research has happened as well, and in different things, like you can see about disclosure, about the stress, about validation of different scales, about pediatric psycho-oncology, about survivorship. So this is all Indian research that I'm showing you. So we have done there. However, we still have very few psychiatrists. So this is rephrasing Oscar Wilde, the importance of being earnest. I have said the importance of being psychiatrist in cancer care. And why do we need more of psychiatrists in cancer care? So what is one of our main skills? Communication skills. And if you do the PubMed search, just put communication oncology training, 36 papers or 31 results at least. So because we are supposed to be masters of communication skills. Who are we? We have the ability and the training and the expertise to make that distinction between normal, in between, or disorder, right? So we have that ability. What is the biopsychosocial model of mental health? Ultimately, it is biology. The social will work through biology. The psychological will work through biology. Whatever you say about neuroinflammation, whatever you say about anxiety, everything is going to work through the brain. And in this biology, you see you have genetics, you have disease, and oncology being an inflammatory state, you can see how much of mental health is going to be. And do we not do that? We said about biological, psychological, social. You go to depression, it is the psychosocial factors, disease-related factors, medical and demographic factors. Who are the masters? We are. Go to anxiety. What about that? Predisposing factors, cancer-related fears, disease and treatment factors, symptom burden. What is the monitoring? How do we cope? Long-term outcome, short-term outcome. Who are the masters? We are. And we talk a lot about, do psychiatrists do only medications? And you will hear 7 medications in one list and everything will be included. No, psychiatrists are pioneers in setting up psychotherapies. All these people that you are seeing, Dr. Gary Rodin, Dr. Harvey Max Chochinov, these are psychiatrists. So both of them are in Canada, and these are psychotherapeutic interventions in cancer, in end-of-life care maybe, so dignity therapy, calm. These are other ones, our meaning-centered psychotherapy. So Dr. Breitbart took over MSKCC chief after Dr. Holland retired, and Dr. Breitbart and Dr. Kissane, Dr. David Kissane took up after Dr. Holland, and Dr. Breitbart came later. but these are all psychiatrists. So when Dr. Shobha organizes psychotherapy workshops, it is also our responsibility. We are supposed to be the biopsychosocial environmental, and we are the masters. So anybody who knows me will know my tagline is, it used to come in my signature, but I've left it, I don't know why, proud to be a psychiatrist. So this is what we need to be. Because what is the need in cancer? Identify distress. What can we do? Diagnostic expertise. What is it in cancer? Adjusting to illness. What do we do? Psychotherapy, medications, right? Treatment adherence. We keep on talking about treatment adherence in so many psychiatric disorders. Here it's the same thing. So behavioral interventions. And who understands spiritual, existential, part of mental health? So that is existential care. So we have all this. And this is a wonderful book written by Dr. Holland in 2000. It's actually for the patients. And it's written very simply and very nicely about each of these things. You know, what you can do, what you shouldn't do, and, you know, don't do this, do that. And she's written very clearly when it is more than sadness, when you're not getting out of bed, it may be fatigue, but you need to think about depression. So tell your doctor, tell your oncologist, try to meet a psychiatrist. So he's done that. So 9th April 1928 is her birthday. So in honor of that, the International Psycho-Oncology Society has put it as the World Psycho-Oncology Day, which we just celebrated. This was the second year that we celebrated all over the world. So it comes back to her. And I told you that psychiatry. So the future of psycho-oncology will also depend on how many of us psychiatrists decide to work in this space. And we now have the Psycho-Oncology Society of India. So you can go to the website, and the way forward is like, let's engage, let's elevate, and let's empower. So I cannot finish because of a long list of gratitude that I have for here, and most of the people, you will see them. Some of you I have worked with, some of you I have not worked with, some of you I have worked with but have gone. So that is there. So for me to be able to stand here today is, you know, a huge work from my teachers, which is Dr. Parker stroke Dr. Lakrawala, because I was Dr. Lakrawala's student. Don't know, and then Sir left, so I became Dr. Parker's student. Dr. Apte, who was the first one to ring up as soon as the BPS notice went. So that is Dr. Apte for me. Dr. Sheth and Dr. Vaya and Dr. Pradhan. Dr. Pradhan is there. Dr. Vaya and Dr. Sheth I used to get quite scared of initially, but then, we've become friends. And of course, there are some people who are how we have agony uncle, so I have agony friends. So that's Dr. Shilpa Adarkar, Dr. Nirja, and Dr. Malay Dave, who has been tasked with taking a photo of me here. So can't call agony aunt and agony uncle. And my special gratitude to Dr. Savita Goswami, who was sitting there, psycho-oncologist, and you have to believe it, it was her business proposal to the director of Tata Hospital to get a full-time psychiatrist. She said that it cannot run as a part-time, because we had honoraries, we had Dr. Tungaji, we had Dr. Pradhan, but it couldn't. So a special thanks to Dr. Savita. And of course, Dr. Shobha Nair, who I think I have been the agony friend for this, and my friend over the years, Dr. Alka Ahuja in the UK. I have to thank some of my seniors, Dr. Pervin, who is there, who came in the morning, but she had to go, and Dr. Abhilash, who is in the US. Of course, the BPS, that training committees, and I got into BPS, the presidents I've worked with, Dr. Kumawat, Dr. Kersi stroke Kersi, I never know what to call him, and Dr. Haenel, and the next president, Dr. Bagadia, because I troubled you as well. And so for my current working space that we have, the director of Tata Memorial Hospital. We have Tata Memorial Center, Tata Memorial Hospital. I am grateful to both of them. Tata Memorial Hospital, the director is Dr. Pramesh, from whom I learned everything research. And that is why, sorry, I was giving pravachan to Dr. Neena, and Dr. Ashish heard me. That is that obsession with research that is there. Of course, my colleagues in, Savita is here today, my colleagues in Tata Memorial Hospital Psycho-Oncology Department, and since I head palliative medicine, my colleagues in palliative medicine. And there are some international friends, international mentors that I have in IPOS, of where I am the honorary treasurer. So I have to thank them. And two sort of absolutely non-psychiatry mentors, Dr. Arnie Purushottam from King's College, Dr. Frank Ferris from San Diego. They are the two ones. And my mentors in Belfast, because I wouldn't have learned all this without them. Of course, ultimately, who did I learn from? I learned from our patients, and I learned from our caregivers. But of course, to stand here, you have to acknowledge, I have to acknowledge the support of my family, which is my husband, Kedar Devdhar, and Dr. Ashish, you are also in that, because, you know, we went to Parle College, our spouses went to Ruparel. So both, so then we are more connected than we thought we would be. And Dr. Ashish, and you should know, because other people know, that is like 43 years and running that we are friends for. So hopefully we will continue and we won't fall out. But so as I was talking about Kedar Devdhar, for people who know Kedar, because he sent Nina as a spy, so I have to say nice things about, and Dr. Mundra, I have to say nice things about him. He is incredibly patient and tolerant, without whom I would not be able to do all this work, and he probably thinks I did it to get out of all the housework. Thank God Dr. Armida said she didn't like housework. I have some senior to look up to, so he thinks, he must be thinking. If you think my sense of humor is great, you should meet my daughter, Uma, and my sister, Gargi. And all of us get it from my father. My mother is not here today, but I'm wearing something that she gave, and I think she would have been incredibly proud of me today. And not to forget my incredible in-laws, you know. So my mother-in-law would have said, Barazala Uttam. I can hear her in my head that she would have said this had she been there. My father-in-law would have smiled benignly. Ye kya cheez hai? So benignly. And because they are not there, I have a proxy in-law over there, Dr. Mundra. Only because he is my in-law's neighbor, the same building. So he probably knows Kedar more than any of you do, including Neena and this. So thank you so much to everybody. And of course, again, thank you to BPS and Dr. Yalla family, and Dr. Shobha, Dr. Prashant, and the entire team. And a special thanks to Dr. Dawle and Dr. Ashish. Thank you very much.